I am Jam Chelsea Faye Velarde. I'm going to be your student nurse for today, okay? Okay. So, may I ask what is your name?
Shalia Isabel.
Okay. When is your birthday?
My birthday is May 25.
May I check your wristband? Okay, ma'am, may I ask you what you want me to call you?
Just call me Yami.
Okay, Miss Yami, what we're going to do is I'm gonna be doing a complete bath for you. Is that okay with you?
Yes.
Okay, so may I ask you how often do you usually take a bath?
Every day.
Okay, so good. Do you still able to move around?
Yes.
Okay, so good. May I ask you if do you have any skin problems?
No.
No. Okay, very good. Do you feel comfortable now?
Yes.
So what I did a while ago is I did introduce myself. I asked the patient identification, her name, her birthday, and confirm it on the wristband that she is wearing. And also I explained the procedure to the client, and that is done to establish rapport with your patient. And also I did assess the patient to ensure the safety of my client. And the next thing that I will be doing is I'm gonna be asking if she still needs to use the toilet. That is done to ensure the patient's comfort. Okay, so Miss Yami, we're gonna be starting with your bath. Okay. Okay, so would you still need to void at this time?
No.
Okay, so no. All right. So let us start.
Yes.
Okay, so before anything else, it is very important to wear gloves during this demonstration. It is important for the protection of your patient as well as yourself. Okay, so now I'm gonna be raising the bed to a convenient working height, and I'm gonna be lowering the side rails that is near to me. That is done to avoid undue reaching and straining. Okay, so now I'm gonna assist the patient to move near me so that to promote good body mechanics and to ensure the patient's safety. Okay, Miss Yami, can you please move here? Okay, so now I'm gonna be placing the bath blanket over the patient, and I'm gonna be removing the top sheet beneath and place it on the hamper. Okay, so this is my bath blanket. So bath blanket provides comfort, warmth, and privacy for the patient. Okay. Miss Yami, can you please hold the bath blanket? So I'm gonna remove the top sheet, okay? Hold the bath blanket. Okay, so after removing the top sheet, place it on the hamper. Okay, so now I'm gonna be removing the patient's gown. So remember that if the patient is intravenous line injury or reduced mobility, begin on the unaffected side. Okay, so Miss Yam, I'm gonna be removing your patient gown. Okay. So now I'm gonna be filling the basin with 2/3 of warm water with a temperature of 43 to 46 degrees Celsius, and I'm gonna be checking the temperature to ensure that the water is in a comfortable temperature. And also I'm gonna be letting the patient to check the temperature of the water to make sure that the client can tolerate it. Okay, so let us assume that there is water in this basin, since I won't be using any water for this demonstration. Okay. Okay, so if this just enough, can you please check the temperature of the water, Miss Yang?
It's fine.
Okay, can you tolerate it?
Yes.
Okay, good. Okay, so now I'm gonna be asking the patient if it is okay for her to remove the pillow. Okay, so Miss Yami, is it okay for you if I'm gonna be removing the pillow?
No, it's fine.
Okay. Do you feel comfortable if that pillow will remain on your head?
Yes.
Okay. So the patient refused to remove the pillow because it is much comfortable for her if she uses a pillow. Okay. So now I'm gonna be proceeding onto washing the patient's face. Okay. So here I prepared 2 towels. The first towel will be placed under the patient's head, and the second towel will be placed over the patient's chest. Okay, so this towel will serve as a dryer for the patient's face. Okay, Miss Yami, you still will you be able to raise your head? Okay. And then this one is over the patient's chest. Okay, so now I'm gonna be washing the patient's eyes with water only, and also after that I'm gonna be drying them with the towel provided. And also remember to use a separate corner of the washcloth for each eye. That is done to prevent the spread of microorganisms from one eye to the other. And also remember to wipe the eyes from the inner to the outer canthus. Okay, so this is my washcloth. I'm gonna be making a bath mitt to this washcloth. Okay, so now let us proceed onto washing the patient's eyes. But before that, ask the patient if she prefers to use a soap on her face. Okay, Miss Yami, do you prefer to use a soap on your face?
No.
Okay. Okay, I'm gonna wash your eyes. Okay. Okay. So after that, again wet the washcloth to be used on the face, the ears, and the neck. Again, I'm gonna be making a bath mitt. Okay, remember to wipe outer. Maybe washing your ears. Other side. The neck. Okay. So in wiping the neck, do it upward. Okay, so if the client is male, ask if he wants to be shaved. Okay, for an unconscious patient, wash the eyes with a plain water only and dry them well, starting from the inner to the outer canthus. using a new section of cloth for each eye. And also, if prescribed, instill an eye drops or ointment. If no blink reflex, keep the lids closed. Gonna be using an eyedropper. And close the lids properly, and then place an eye patch. Okay, so now I'm gonna be washing the patient's arms and hands. In doing that, I'm gonna be exposing her forearm, and then I'm gonna be placing the bath towel beneath her arm. Okay? Can I see your hands, ma'am? Okay, so now I'm gonna be washing the patient's arms and axilla using a soap from distal to proximal. And after washing, I'm gonna be rinsing and drying them with the bath towel provided. So remember that film strokes from distal to proximal areas promotes circulation by increasing venous blood return. Okay. Then after that, dry them with a bath towel. Okay, so do the same with the hands and the nails. Okay, so remember to pay attention to the spaces between the fingers. Okay. Okay, again, I'm gonna be adding a soap. Okay, so after that, I'm gonna be drying them with a bath towel. Okay, so do the same with the other arm. now I'm gonna be washing the patient's legs and feet. In doing that, I'm gonna be exposing the patient's one leg by folding the bath towel towards the other legs. Okay, so remember to keep the perineum covered. Okay, and then after that, I'm gonna be placing the bath towel lengthwise under the legs. Okay, so Miss Yami, I'm gonna return the bath blanket. Okay, so now I'm gonna be folding the bath blanket towards the other leg while ensuring that the perineum is covered. Okay. And then I'm gonna be placing the bath towel lengthwise under the leg. Okay, so now I'm gonna be making a bath mitt using a washcloth. Okay. Okay, so now I'm gonna be wiping the patient's leg from the distal to the proximal. Okay. Okay, and then dry them. And then put the washcloth into the basin. And then proceed onto the patient's feet. Okay. So remember to pay attention on the spaces between. And then dry them. Okay, so after drying, apply a lotion on the foot of the patient to keep the foot moisturized. Okay. Okay, so after applying the lotion, reverse the bath towel and then do the procedure on the other side. Okay, so it is also important to perform a perineal care to the patient, but for my case, I will not be doing it since it is not as necessary. Okay, so after that, I'm gonna be discarding the washcloth and I'm gonna be refilling the basin with a clean water, and also I'm gonna change into a clean pair of gloves. So now I have here a clean warm water and a new washcloth and also a clean pair of gloves. Okay, so now let us proceed into washing the patient's back. In doing that, I'm gonna ask the patient to, I'm gonna assist the patient into a side-lying position facing away from me, okay? And I'm gonna ensure that the patient is covered at all times, okay? Okay, Miss Yami, can you please move your body facing away from me? Okay. Okay, so after that, place the bath towel on the patient's back, lengthwise on the patient's back. Okay, so now I'm gonna be proceeding on to washing the patient's back, moving from the shoulders down to its buttocks and the upper thighs. Okay, using my mitered hand. Again, I'm gonna wash the washcloth. I'm gonna do a mitered hand. Okay, so remember to wipe the back from the shoulders to the buttocks and the upper thighs. Okay, okay, so after washing, dry the client's back using the bath towel. Okay, so after washing the client's back, buttocks, and upper thighs, remove and discard the gloves and then ask if the client prefers to have a back massage. Okay, so Miss Yami, would you want me to perform a back massage?
No, no.
No need? Okay, so the patient refused to have a back massage. Okay, so now I'm gonna be helping the patient to put on her new gown. Okay, Miss Yami, we're gonna change her clothes. Okay. Can you please insert your hands here? The other one. Okay, so after putting on the new gown, comb the patient's hair. Remember to untangle the hairs. Okay. Okay, Miss Yami, we're gonna comb your hair. Okay, so after combing the hair of the patient, I'm gonna place the signal device near the patient. Okay, so Miss Yami, we're all done now. Okay, so I'm just gonna place the signal device here. Okay. So do you have any question or any concern before I leave? No. Okay, no. Okay, so thank you very much, Miss Yami. If you have any question or any concern, don't hesitate to call me, okay? Okay, so I'll get going now.
Okay.
Okay, thank you very much.